Welcome to The Explainer. Today, we're going to tackle a topic that affects millions of people, but, can be really confusing: bowel disorders. We're going to break down the huge difference between a gut that's just irritated versus one that's literally being attacked by the body's own immune system.
From what feels like a minor annoyance to a full-blown medical emergency, we're going to sort through all the confusion about what can go wrong in there, and we'll use our source material to guide us every step of the way.
So, here's our game plan for this explainer. We'll start with a big picture overview. Then we'll look at non-inflammatory and inflammatory conditions separately. After that, we'll get into the management playbook and then wrap up with the really crucial stuff, knowing when something becomes an emergency. Let's get right into it.
Okay, let's dive in. The absolute best way to start thinking about this is to split all these disorders into two big families. Honestly, getting this distinction down is the key to understanding everything else we're going to talk about. So here it is, the fundamental split. On one side, you have the non-inflammatory crew. These are issues that are more about function. Things like irritation, a physical blockage, or muscles not working quite right. But on the other side, you've got the inflammatory conditions, and this is where the body's immune system gets involved and starts causing chronic inflammation. Two totally different worlds.
Let's start with that first group, the conditions where chronic inflammation isn't the main problem. And these include some of the most common gut issues that people deal with every day.
And first up is a big one: irritable bowel syndrome, or IBS. This is a classic functional disorder. What that means is if you look at the bowel, it appears perfectly normal, but it just doesn't work the way it should. And the tricky part? The cause isn't just one thing. It's this complex mix of genetics, your environment, and even stress, which makes it super hard to pin down.
And what's so interesting here is how you can see all those different influences at play. You've got environmental triggers like coffee or dairy. You've got the immune system playing a part. And of course, there's that really strong connection to stress, anxiety, and depression. It just goes to show you IBS really is a mind-body condition.
So it makes sense, right? Because the causes are all over the map. The management has to be really personalized. It's usually a combination of things: finding ways to reduce stress, cutting back on irritants like caffeine, maybe upping your fiber, and this is a big one: keeping a detailed diary to figure out what your specific personal triggers are.
I love this slide because it illustrates another major non-inflammatory problem so well: blockages. A mechanical obstruction, well, that's like a literal traffic jam in your gut. Something is physically blocking the road. But a non-mechanical one is totally different. That's when the road itself just stops working, the muscles stop moving, and everything grinds to a halt. And finally, for this category, let's talk about hernias. You can think of this as a weak spot in the wall of your abdomen. When pressure increases, say from lifting something heavy, tissue can actually push through that weak spot, creating a lump that you can often see or feel.
Okay, this is huge. For a hernia, this is the #1 warning sign. If you listen to the abdomen and hear nothing, it could mean a piece of the intestine is trapped and its blood supply is cut off. That is a true medical emergency, no question about it, and it needs surgery right away to prevent permanent damage.
All right, let's switch gears and move to our second category. This is where we're going to see how chronic inflammation, driven by the immune system, just completely changes the entire picture.
Before we go any further, listen up. If you only remember one thing from this entire explainer, please let it be this: inflammatory bowel disease, IBD, is not the same as irritable bowel syndrome, IBS. IBD involves inflammation that causes physical damage to the bowel. IBS does not. They are two fundamentally different things.
So what is IBD? Well, it's the family name for these chronic inflammatory conditions. The two you've probably heard of are Crohn's disease and ulcerative colitis. Now, unlike IBS, the inflammation here actually causes physical damage, and that can lead to some serious complications, like intense pain and making it really hard for the body to absorb nutrients.
Now, because these conditions can show up in different parts of the gut, doctors use a whole range of tools to figure out what's going on. You can see here, for ulcerative colitis, they might use a sigmoidoscopy to look at the lower part of the colon. But for Crohn's, which can be anywhere, they might need an endoscopy to look at the upper GI tract. It's all about picking the right tool for the job to see exactly where that inflammation is.
So, you might be wondering, with such different root causes, functional problems on one side and this immune-driven inflammation on the other, how does the day-to-day management actually look? Let's open up the playbook.
For IBD, especially during a flare-up, the game plan is all about getting as much nutrition as possible while being as gentle as possible on the gut. That's why you see advice for high-protein, high-calorie foods to fight off weight loss, but low-fiber foods to give the inflamed bowel a bit of a break. Small, frequent meals are also way easier to handle. And of course, keeping a close eye on weight and electrolytes is absolutely vital, since that inflammation can really mess with nutrient absorption.
Now, for something like an acute flare of diverticulitis, the dietary approach is like a 3-step reset for your gut. First, you give it a total rest with just clear liquids. Then, once things start to calm down, you gently reintroduce really easy-to-digest low-fiber foods. And only after that, you slowly start building back up to a high-fiber diet for better long-term health.
Okay, finally, we have to talk about the most serious complications. It is so important to understand these red flags because these situations can absolutely be life-threatening.
Peritonitis is one of those worst-case scenarios. It's what happens when the actual lining of your abdomen gets infected. This is often because a hole or perforation has formed in the bowel, letting bacteria leak out. This is a massive medical emergency.
And this is the classic telltale sign. The muscles of the abdomen become hard as a rock, completely rigid. It's an involuntary reaction to the intense inflammation happening underneath. If you ever see or feel this, it's a massive red flag that something is seriously wrong.
And then there's this, another critical emergency called toxic megacolon. It's a severe complication, usually of IBD, where the large intestine swells up to a dangerous size. The wall of the colon gets super thin and is at an extremely high risk of tearing open, which of course would lead straight to peritonitis.
So at the end of the day, it all comes back to this one key idea. Yeah, a lot of these conditions can cause similar symptoms, pain, bloating, you name it, but it's the underlying cause. Is it irritation, a blockage, or is it inflammation? That is everything. That's what determines the right diagnosis and the right path forward. And that really leaves us with this final thought. Look, the goal here isn't for you to self-diagnose. It's about being a more informed partner in your own healthcare. Knowing this stuff empowers you to ask smarter questions, to better understand why your doctor is recommending a certain treatment, and ultimately, to be a stronger advocate for your own health.